Chris Crawford, thanks for finally being on the podcast. I know this is a long time coming. I appreciate you being on and kickstarting back the Let's Grab Coffee podcast.
Yeah, really looking forward to it. Thanks for having me.
So, for folks who might not know you, you are currently the founder and CEO of RxSaveCard, which allows employers to access prescription drug, cash, and discount card prices, which allows both the company and employees to save money. We're going to get into all of this. And as I said before, I think what folks would really benefit from hearing is just kind of debunking a lot of the complexities in the pharmaceutical space, which, as you know, could be a bit tedious and very technical unless you actually are in the industry. So I'm excited to get your take on all of this, your thought leadership. What I usually do with episodes before we get into the nitty gritty is just get to know the person behind the business. And, I think you have a stellar story. So I wanted to start with you in terms of how does someone start with an accounting background and find themselves in the in the pharmaceutical space or the healthcare space?
Yeah, it's a great question. I think accounting, I've got a daughter in college now and more kids kind of thinking about it. And it's like that big question, right? Like, what do you study? I was first person in my family to go to college. And so just kind of getting advice from my counselor. And it was like, well, the world needs accountants. So go be an accountant. I'm like, well, that sounds good. I like business, I think, and accounting degree sounds good. And it was actually, fantastic training, just learning about businesses, learning the basics of financial statements, how businesses make money, cash flow, and everything else. So it was a great training grant, and just it's sad in a way to go back because I started a company called Arthur Anderson that doesn't even exist, and in Chicago it was the headquarters, and at the time that was, the place to go work, and just the network, still the people I still keep in contact with from there, and just things I'd learned from my peers, my managers, my partners. It's just like the ultimate training ground to get started. So loved all that. Didn't like being an accountant very much. So I think that's sort of what I realized after a couple of years. Like, maybe I want to be more, talk with clients every day, helping solve problems versus kind of being, in the details of financial statements. So then that's when I went into, I actually was an executive recruiter, placing accountants in
Really?
corporate America. Yeah. So always a good experience to be 100% commission, at some point in your life. And my parents were like, you're a CPA. Why did you do all this? I'm like, I don't know. I got a plan. And so that was just a really good experience of being in sales, right? And kind of figuring out how to connect with people, how to solve problems. And that is what led me into ultimately join Mercer. And so Mercer at that point was bringing in salespeople for the first time. And so it's a really great experience where I knew very little about benefits or, HR, but I was inquisitive and liked to ask questions. And so that was a great training ground. And that's really got my start in the, I'll call it the benefits, HR, and now ultimately, pharmaceutical space that's going on. Yeah. 25 years, something like that. So
Nice.
it's been a while, and it's been a lot of fun, and it's interesting to just see how much things change, in this industry. And now I think we're at this pace of hyper change. So it's an exciting time to be in it.
Yeah, 25 years going strong, my friend. What were some of those early questions you were asking at Mercer?
I think at Mercer, it was such a big company with so many things to do, so an ultimate training ground, I think, for a young person coming in, which it was, just reach out to benefits leaders and folks in HR and just ask a lot of questions. And so I think, one of the benefits sometimes, and I have to remind myself of this, is when you aren't an expert in the space, you get to ask a lot of questions and you kind of learn pain points and you learn, what people are dealing with. And so my job at that point was ask a lot of questions, find out what was, something that, those employers needed help with, and then go back to Mercer. And, there were experts everywhere in every different field and, across the United States and across countries, where sort of the problem was I felt like we could find somebody that could help solve it. And then so then you bring the person out, then you hear, how we're going to help solve that. You work through the projects, you just kind of keep picking up a new skill or learning something new, really on every project and with every client. And I think a key thing there, just in consulting in general, is just good to know that clients make decisions in different ways, and what, there's no cookie cutter solution for what an employer is trying to do with their workforce, where it kind of sits, how they want to manage financial goals, employee attraction and retention. Just is no one size fits all. And I think that's what was just a huge lesson that I still take to this day is how can we be flexible to meet employers where they are.
Was it a steep? Because I think there, now that you're saying this, I see the connectivity between accounting, consulting, and even the, I mean, any industry you're going, I think the accounting background really helps because you're very detail oriented. You're trying to connect the dots. You're sort of buried in the minutia. But was it difficult for you, sort of a steep learning curve, to crack into the benefits, the employer services space initially? Because I think someone listening to this might be thinking about pivots as well,
Yeah.
whether it's in corporate or corporate to startup or startup to corporate. And I think I always like touching a little bit more on the pivot side of one's career.
Yeah. I think the thing that I would just caution people to do is just make sure you're very aware of what you know and what you don't know, and just being open, I think, with the people that you're talking to. So I'd be very open to the employers that I was working with and calling on is I'm just here to ask questions, and I want to keep asking more and more questions to make sure I truly, truly understand. And the more questions I ask, the more I understand. And then I can explain it in layman's terms, to our experts when they come back. I think the worst thing, and I just always had to watch myself of never wanting to give advice if I truly didn't understand it or if I truly didn't know it. Because I feel like that's the worst mistake you can make is feeling pressured to say something if you don't know the right answer. And so I just always tried to remind myself to not do that, be very open with my knowledge set, what I knew and what I didn't know. And I think that was a good way to start it. Now, clearly, as you progress in your career and everything else, you pick up more information, you become more knowledgeable, you become a student of the game, and then you can, share what you know. But anybody getting started, just keep asking questions because I think there's also a tendency, especially I would say some consultants, who are really smart and have worked at this stuff forever. It's like they're waiting for a chance to tell you what they know versus totally listening to the end thing that the employer really wants to do. And so sometimes people could, uh, you're talking to a potential buyer or customer and they're laying out their problems, but you kind of jump in before they get to the real problem with your solution set. So I think just giving space, making sure you can ask questions and like truly understand what's really driving it is the best way to handle that.
Yeah, that's very interesting. I mean, you spent most of your career, if I'm not mistaken, you were always in Chicago. Isn't that correct?
A couple years in Denver, in Colorado, with Mercer, but otherwise mostly Chicago. And that was actually interesting because there, I don't think I'd ever been to Colorado before I moved out there. So it was like I didn't know the industry, didn't know anybody there, didn't have a network. So that's the ultimate, which is I'm just here to ask questions and learn, as much as I can.
So you go to Denver a little bit for work, basically. You kind of relocate with Mercer to Denver.
Yep. Yeah,
Nice.
well, that was my first job. So it's like, hey, we're not hiring in Chicago. We're hiring in Denver if you wanna, come out here. So I mean, it's a great experience. Love the mountains, learned to
Yeah, obviously.
ski, did all that stuff. Now the mountains are kind of in my blood, but yeah, it was a really great experience.
So all 7 years were in Denver.
No, two in Denver, and then Mercer was really great about moving, me back to Chicago. It's always kind of like a shorter term thing where Chicago was going to be home. So
I
I've been
see.
in Chicago since now for the last 20 straight years. Yeah.
What did you see early on between Denver and Chicago? Curious from a city perspective, was one harder or easier to crack into?
That's a really great question. And I think Denver's probably changed a lot since I've been there. What I found was for Chicago, as you've learned, I think being here, it's a pretty connected city. It's like if you go through, I mean, my closest friends to this day are friends of mine from college at the University of Illinois that we have been all living in Chicago for however many years, since we graduated. So I think as a new person coming into Chicago without a network, I think it could probably be a tough industry to crack. Where Denver, just so many people were transplants. There were very few locals because it was just a desirable place to live. So a lot of people were moving out there. And so for that, I think you had a lot more openness to meeting new people and new people coming in. But it was a really, I'll call it a middle market town, then not a ton of large employers. And I think it's obviously just blown up and yeah, probably much different market now as far as employers there than when I lived there.
Mm, very interesting. Yeah, I've to your point, I've been here for 5 years now, and it's funny to me. Like Chicago is very much, I would say, similar to Toronto. I would even give it the same analogy to your mid-market example. Where to me, it feels like a small town, even though I know it's a large city. It's the third largest in the U.S., but it still has that connectivity where it seems very intimate and personal. But at the same time, it takes a while to really get those relationships moving and building that momentum, especially if you're new. And I also think Chicago has changed within the past couple of years. So you've been here much longer than I have. So you've seen kind of the old vintage, the new vintage. I've only been here for 5, right? And a lot has changed within those 5 years, post COVID as well.
Yep.
So
Yeah, I still think it's an amazing city to do business in. There's large companies here. It's because it is small. I believe also reputation does matter.
mhm.
People want to work with people that they trust, and so that you do. To your point, you kind of get this small community feel. Almost in there where word does get around of what people do and who's good, who can be helpful, who can relationships really do matter. And
Hmm.
I think that's one of the reasons why I like it so much. It's just, people who do what they say they're going to do, and you quickly learn out, who those people are that you can count on and trust.
Love that. Love that. So we're back in Chicago. At this point, you decide to leave Mercer, right? And from what I can tell in your career, it's been sort of different stints of consulting mandates at different firms, in sort of senior positions. Did you know at that point when you left Mercer that this was the track you wanted to start developing?
I knew I wanted to be in a smaller company. I think,
Mhm. More boutique,
yeah, I'm
right?
just impatient person by nature and getting stuff done. And Mercer was amazing for the opportunities that it granted, people and recognizing people and giving a lot of opportunities. And I think also with that, though, then you realize, is this really what I want to do? And I think what I realized is I just, I liked being with customers and solving problems and kind of being in more of the, it's kind of day to day, working with things where large organizations and kind of management and, those kind of pieces taking you further away wasn't really where I got a lot of my energy. And so I think that was also the idea of, well, all right, let's do something on my own and start a business. And so again, back to going into being an executive recruiter, 100% commission. I guess I'm
You're
okay with
comfortable.
calculated risks, and I saw an opportunity, in this market and wanted to give it a go. Yeah, so you go from a huge company to again being by yourself with no clients, no revenue, just an idea of,
A
of
good time.
of something that you want to build. So that was a lot of fun
And
and
that,
hard, and all those other kind of things that everybody talks about. It's like, if you knew how hard it was when you started it, would you still, do it? Probably not. Of course, here I am again. So I don't know. Maybe I'm just not that bright or something to go about it again. But it's so rewarding when it works.
and that was when you started a CMC advisory group,
Yeah,
right?
exactly. And so yeah, that was in the benefit space. And so sold that business in 2010. And so that was also, the size of the groups you were working with. Pharmacy, kind of getting back to RX, like it just became the bigger issue. So before it was you're dealing with all things medical and hospital pricing and carriers and what's called network discounts and the medical procedures. And then pharmacy just kept ticking up as being more and more and more important
Hmm.
and more of a driver of costs. And also, I think as an advisor, what I realized is I didn't know enough. Like you're when you're negotiating with pharmacy benefit managers on behalf of employers, they have the information, they have the data. How they write contracts and things like that is clearly to benefit them financially. It's how they make money. And to really be able to do that, you have to be an expert at pharmacy and know it really well. And I think that's something you see a lot of benefit consulting firms doing now, is sort of figuring out, hey, we can't just be a generalist on this. Like, we actually need deep subject matter expertise. And after merged with Cunningham Butler, which is the company that bought CMC Advisory Group, and they were amazing people and loved it there, I just wanted to get deeper into pharmacy. And so I joined a friend of mine that had a pharmacy benefit consulting business. And that was just a great experience of working these huge contracts multi-billions of dollars under management, and just seeing these large contracts and how they work, and just getting, kind of the deep knowledge on PBM contracting, how it works, where the money's being made, how that impacts employers, really just focused on the pharmacy benefit industry since it's fascinating. And I think over that time too, it's become more and more of an issue, so fast forward now, we're recording this in October, and over the last 4 months, we've seen front page articles in the New York Times, Washington Post. We got the FTC, looking to break up some of the big PBMs. You've got PBM executives having to testify before Congress. We've got, lawsuits where first class action lawsuits of employees suing their employer for violating their fiduciary responsibilities, specifically to pharmacy benefits. So it is the issue. It is kind of it's just a fascinating time with so much change happening all at once. And it's just one of those things that used to be a smaller number. It wasn't really material to your overall benefit spend or healthcare spend. And now it's really the thing that most are focused on.
Let me ask you this. Before we get to RX, I want to drill down on two things.
Yeah.
And this will be the last part on the consulting phase, but I really do want to drill down for people who really aren't in this industry and know nothing about it. What were you actually doing on the consulting side? I think that would be a nice segue before we get to RX. So I want to ask about the consulting. Give us kind of like an example of maybe a project that you worked on. And then I want to drill down a bit more on the PBM space, i.e. what does the map actually look like in the US for folks who might not even live, in this side of the world?
I think it's a really great question to take a step back. So it's like, what do consulting firms offer and what do they do, right? I mean, so first and foremost, it usually starts with the people, the person who's the lead consultant for that employer, who's a subject matter expert in whatever that issue is that the employer is dealing with, right? So it's like, have they been through the space? Have they seen it 100 times before? Do they know kind of all the questions to ask and the options? Then it's really data. What information do we have? What tools do we have? So at Mercer, for instance, it could be, we need to do a compensation benchmarking. Who runs study and surveys that has, all of this data? It could be in healthcare. It could be, we've gone through our claims repository. What does that look like? What are average? What are trends? And so I think it's taking all the data, then having experienced people who've dealt with that data before, translate that back to employers, and then good consultants, in my opinion, lay out those options for employers based on, you told me this is what your really pain point is. Here are the options we brought to you. Here's the data to support those and kind of the pros and cons along with them, so that the employers then can make educated decisions in subject matter areas that they're not an expert in. And so I think just so many of these areas, it's like, well, if you run a pharmacy benefit, request for proposal every 3 years when you're evaluating it, you do that once. Is it realistic to think you're going to understand all the different data flows, points in a contract, all these things, compared to a consultant who maybe has done it 100 times, in the last year? So I think it's just that knowledge of the market, knowledge of solution sets, knowledge of emerging, I think, ideas, technologies, vendors, basically bringing all that back to customers with information and how it would fit, all into what that employer is doing.
Love that. Okay, much clearer now, at least to me, and hopefully people listening. So with that, I wanted to ask you to just break down what does PBM mean, number one, and number two, for someone not living in the US, can you give us like a very quick, brief, high-level overview of what the ecosystem actually looks like from your vantage point?
Yeah, so PBM stands for Pharmacy Benefit Manager. And so over the last few years, pharmacy benefit managers have merged in with other, I'll call it, health insurance carriers or providers. So, little known stat, or at least this kind of blows me away, especially for folks who don't live in the US. But if you look at the top 16 companies in the Fortune 500, 3 of the top 16, United Healthcare, which owns Optum, which is their PBM, CVS Health, which has Aetna, the insurance arm, and the PBM business, and then Cigna, which has Express Scripts, which is the PBM business. So when you think about that, those 3 companies are 3 of the 16 largest companies in the Fortune 500. And the PBM, the pharmacy benefit, the PBM business, I like to think of it, it's really what opens up all the profitability for those organizations. Because when you own the PBM, then you get to sell those services back to the health insurance company, right? And you get to decide what you're going to charge that health insurance company. So if I have a health insurance premium and it's called fully insured, meaning I'm offering rates to the marketplace, right? Nobody's telling me what I can charge my own insurance company for that drug or what I'm making, somewhere else. And so it's this really fascinating business where it's, so a pharmacy benefit manager, for folks who aren't aware of it, they set the price that employers pay for drugs, even though they don't buy the drug, right? They're the pharmacy benefit manager. So they're telling the employer, this is what you have to pay. And then they're negotiating with pharmacies for a price. And basically, I'm going to charge the pharmacy, I'm going to pay the pharmacy $2, for this drug. I'm going to charge the employer $4 for that same drug. I've made $2. That's called spread. That's my profit. That is the traditional business model of a pharmacy benefit manager. And 90% of all PBMs in America, of the volume, operate in that manner. So, and it gets better. The pharmacy benefit managers then, what they've done is they've vertically integrated, right? So they figured out, hey, let's combine with health insurance and do these things. And then on the pharmacy side, what they also do is if you want that drug sent to your home, or you can't pick this drug up at a local retail pharmacy.
Like a delivery service.
Yeah, mail order, home delivery, whatever it is. When you do that, they typically mandate that you use their pharmacy that they own. So if you're with a big PBM, when a drug gets sent to you to your home, it's usually coming from their pharmacy. So now what I've done is I've told the employer, this is what I'm going to charge you for this drug. Actually, you don't tell it up front. The employer usually doesn't know until after the claim comes in. So you don't know how much it's going to cost. You can't buy it from anywhere else because I'm telling you exactly where you're going to buy it from, which is from me, which means there's zero competition in this whatsoever. And the PBM business, the pharmacy benefit manager business, almost is you open up the sales channel for every other business that happens because it spreads the revenue around and it spreads volume around. So that is what a pharmacy benefit manager does. So they're approving the drug. So go further. They operate what's called formularies, which means these are the drugs that if you're an employer and you choose them, they tell you which drugs you can buy, which drugs you can't buy. They tell you which drugs require what's called a prior authorization to say, well, if you want this drug, your doctor needs to walk through a couple of these steps, in order to get that drug. Then they also say, oh, and if you want that drug, here's how you have to get it back to that home delivery. You can't pick that one up at a retail store. We're going to have to send that to you. By the way, we're going to send it to you from our pharmacy, when it comes to you. So it's this total control
of the value chain, essentially. They're controlling
of everything in the value chain, right? And then what they also do is where this gets complicated is that it also, so if I'm a pharmaceutical manufacturer and I've just developed a new drug. It's an amazing drug. I want to sell it. I sell drugs. That's what I do. How am I going to sell it? I've got to go through the pharmacy benefit managers. I've got to get put on their formularies. I've got to make sure that it's available for patients when they need it. And let's say there's 2 drugs that could be offered, for it. And that pharmacy benefit manager already has one drug, on the formulary, a competing drug comes out. Now it becomes this money game. And this is where a lot of scrutiny comes in on something called rebates. So basically what a rebate is a pharmaceutical manufacturer negotiating with a pharmacy benefit manager to say, I want my drug to be covered under your formulary. And the pharmacy benefit manager says, well, that's going to cost you. And so what it does is now you get volume. So pharmaceutical manufacturers are paying pharmacy benefit managers for the volume that the pharmacy benefit managers deliver to them through their employer customers. Gets better. Those organizations are, there's a separate organization called Group Purchasing Organizations, or GPOs. So you've got the pharmacy benefit manager and the PBM. Then a few years ago, they started creating another entity above it called a group purchasing organization. That group purchasing organization is the one who negotiates with the pharmaceutical manufacturers. And the group purchasing organization then decides how much they're going to. So I've taken this amount of rebate from a pharmaceutical manufacturer. I'm going to share some of that with my PBM, right? Same company, owned by the same people. I'm going to share it with it. And then from the PBM is going to share some of that back to the employer. So lots of different revenue angles and lots of different, money
Or incentives
to be made, which then gets back to if an employer is like, well, what the heck am I supposed to do? How do I know what information I can rely on? How do I know how much these drugs are actually going to cost me when it's all said and done? Who do I go to for advice, and guidance on all these things, back to the consultants and who's helping me evaluate? It's so complex, and I think when you see the amount of volume that comes through too on a pharmacy contract. So generally it's about one prescription per employee per month. It's kind of generally. So if I have an employer, right, that has, do that math, 10,000 employees, how many prescriptions are coming through? You're seeing about 10,000 prescriptions a month. How do you know the cost of all of those? Like you look at them and I'll see things where the PBM charged, I just posted about this morning, actually, $13,000 for a drug.
That should have cost like $400, right?
What's that?
I saw your link. That should have cost like $400.
Yeah.
I saw your link.
Anybody without insurance could go buy that, right? And those are the things that people are sitting there screwing and say, well, wait a second. How can this make any sense? I thought you were so large. I thought you were negotiating these lower prices. I thought clearly it'd be less if I was going through my PBM. When you turn around and say, oftentimes it's cheaper to not use your insurance at all. And I'm using insurance and PBM, kind of in the same, I'm interchanging those a little bit because people think of their insurance. They don't necessarily think of the back end PBM. But those are the issues you find in those claims. And they're just sort of lurking, in there. Because if you're a benefit manager, you're looking at every 10,000 claim that came through and comparing the price to what's available. It's a tough job to do. But then think if you're an employee, or you're somebody and you're in what's called your deductible phase for people outside the US, which means there's a certain amount that I have to pay out of my own pocket before any coverage kicks in, right? So go through that same example. I'm an employee comes in and I got to pay thousands of dollars out of my pocket. I'm forced to pay that through my insurance, or I don't even use my insurance and I pay cash out of my pocket. Then it's like, well, what was I just paying premiums towards my health insurance plan for? Because I paid premiums, but I'm not even using my insurance because the drug's cheaper elsewhere.
Mm-hmm.
And those are kind of the connection points, that RxSaveCard is really built around, and say there's a marketplace out here with lower prices. And this kind of being locked in to only have prices set by your pharmacy benefit manager. We wouldn't do that in any other procurement strategy of anything we did, right? If I went to any company and said, here's a MacBook over here and it's $1,000. But we have a contract with somebody to provide all of our IT, so we have to get the MacBook from them, and it's $15,000. You wouldn't do that. It's the same exact thing, same exact product, So I think it's trying to bring, some of that clarity to the market and find those opportunities when it is less expensive, and making sure employers can access those prices and employees can also access them. Is a big deal because we think about everything in the aggregate all the time. It's like, well, we spend $10 million on drugs. Well, 5,000 more, 5,000 less, maybe getting back to accounting, like we always learn, materiality. Is this material? Right. Does this really change anything? And no. But if I'm the employee and I'm forced to pay $5,000 out of my pocket for a drug that I need, I've got
5,000 is very material.
And so I think it's important to step back just for, what we remind ourselves every day is there's financial models and there's all these other kind of things, but at the end of the day, people need this drug.
Yeah, there's an actual human behind that drug who also really needs it.
It's a mission critical human behind this drug that needs it. One of those examples I posted about this morning, it helps people with organ transplants, to make sure their organ isn't rejected. That person needs that drug. They need that. These things are literally sometimes a matter of life and death. And I think we just we just always want to stay 100% focused on this. What we're doing is actually allowing people sometimes to get a drug that they couldn't otherwise afford. And that's what we wake up every day thinking about.
Have you heard? I was telling you I did some light homework right before the podcast. I mean, just some stats that to me were kind of mind-boggling. The one I wanted to bring up with you, speaking of drugs, is Zolgensma.
Yep.
Have you heard of this?
I have.
Yeah. I mean, is it still the most expensive in the US?
Not anymore.
It used to be, right? It was like $2 million
Yeah.
for a course treatment. It's a one-time payment, but this is for spinal muscular atrophy, I believe, a rare childhood disorder. But $2 million, a one-time payment is.
Yeah, you've got it's a category called like cell and gene therapies, or these really innovative things. And I think it's tough because if you're a parent with a child who has one of these conditions, if you're somebody who has one of these conditions, and all of a sudden there's this breakthrough technology, like, man, I want to access that, right? And I'm going to stick up for the pharmaceutical manufacturers just a little bit here. It's also, if you're going after these very rare conditions where there's maybe a few thousand patients every year who have this condition, right? Getting back to pharmaceutical companies or businesses.
Right, from a business perspective.
What's my total addressable market?
Very small.
Not many. So if I'm going to go through and do that R&D and develop this and do this, how do I price that to make sure it's appropriate? Now, I'm not saying $2 million is the right fee. I'm not saying anything like that, but it's like you have these kind of rare diseases where people are doing some very cool things, where there's cures now potentially for things that didn't exist today. That's amazing, I think. But then you've got all the other drugs. 92% of all drugs dispensed in this country are generic.
Generic drugs, yeah.
Right? Meaning they've been off patent for a while, and so you almost have to bifurcate it a little bit of say, hey, these really serious conditions where new drugs are coming out, we're looking at the data and they could be blockbuster and really, be the difference between life and death or improve quality of life for people. How you handle those is kind of one decision. But then you got all these other things where it's like, this is just a drug that's out there that costs literally pennies to make. How do we make, and those drugs can also be very important for people managing chronic conditions. People take these drugs every day. How do we make sure they get what they need?
So was this the biggest pain point that led to Rx?
I think the pain points that we saw was just, obviously we've got Congress, we've got all these kind of exposés happening on the pharmacy benefit management industry, people looking at it and saying, well, how does this make sense? How do these folks make money? How do I know what I'm supposed to pay and what I'm supposed to afford? So you kind of had that piece. Then you had, actually give big credit to Mark Cuban.
Cost Plus.
2.5 years ago, yeah, he, along with his co-founders there in the team, said, we're going to sell drugs differently. And, so he created this pharmacy, and his name and passion has really drawn a lot of attention to this. And so when we talk about those examples in the lawsuits, I don't know if those would have been able to happen if you didn't have a published, transparent price that's available to anyone with or without insurance. And that's what Cost Plus Drugs really does. And so now you've got this reference point to compare everything. And so that was a big piece. And then when you looked at it and you started looking at data, you're like, wow, there's a lot of examples here where the cash price is much cheaper than what's being charged by my PBM. And then you have discount cards. So again, for folks who aren't kind of in the US working the system, you can just download, or not even download, you can just go on websites and there's these pharmacy discount cards that you show at the counter. And oftentimes those are less expensive than your insurance. And again, you're thinking, I don't understand. How does this work? And then you've got, the ERISA lawsuit. So in the United States, ERISA, Employment Retirement Income Security Act, which basically kind of manages if I'm paying premiums meaning money out of my pocket, I'm an employee. I'm paying my employer for health insurance for this coverage. Employer, you have an obligation to make sure that those dollars we give you are well spent. You're monitoring the plan, you're making sure we're not overpaying, we're not paying egregious fees, all those other things. And the lawsuit really pointed to those exact examples, which is, you charge me $10,000 PBM, I can buy that drug for $50. over here, and you forced me to pay the 10,000 versus the 50. And then the second lawsuit, that was February, I think, of 2024. Another lawsuit happened in July, alleging the same exact things using basically the same fact patterns. And so we kind of sit back and you're like, okay, well, I've got employers are struggling with, what do I do? How do I manage this? These
And how do you give me visibility, right? Because in many cases, I might not even know.
Exactly. Get back to that 10,000 claims running through. How do I know? How am I going to do that the opportunities are there? You've got these PBMs that I mentioned, 3 of the 16 largest companies in the Fortune 500, large companies, and then employers are comfortable contracting with them. And so it's like, well, how do we help them? And so that's really where we build our solution to say, you don't have to replace your PBM. It can work with any PBM. But in our everyday lives, we shouldn't be bound just by those prices that the PBM offers. If it's cheaper somewhere else outside of it, as an employer or as an employee trying to pick up my drug, I should get access to those prices.
Mm-hmm.
And that's really what we built everything to do, make it a simple add-on. So if it's a discount card that's less expensive, let's do that. If it's going through Cost Plus, through Mark Cuban's pharmacy, it's less expensive, let's do that. If there's a cash price offered, this is a very interesting one. There's a cash price offered directly from a pharmaceutical manufacturer, which there's some examples out there of weight loss drugs and these GLP-1s, which is a very hot topic in the US. The cash price for that, if you don't have insurance, is 70% less than what an employer pays when they're going through their PBM. 70% less. And these drugs, by the way, if you're running through your PBM, they're probably going to cost you $15,000, give or take, per person who's on that drug a year. And by all estimates, you've got north of 50% of the US population could be approved for one of those drugs based on the indications approved by the FDA. So an employer says, this is a new expense. I didn't have this before. What the heck am I supposed to do? Especially if I want to help my employees who do want this drug. I can't afford this. What am I supposed to do? And so that's where, well, let's pay the cash price, directly through the pharmaceutical manufacturers. So we've thought about all these different ways. And really the headline to an employer is, any market that sells the drugs like that we want to access, if they offer a lower price, then you should be able to access those. And that's what we've been built to do.
How do you plug into all those alternative sources through a discount card?
Yeah,
like from the engine perspective, I've always been kind of curious about that.
Yeah, so discount cards really, and this gets back to the complexity of pharmacy benefit contracts and how they work. But it's a really important topic. So when a pharmacy benefit manager contracts with an employer, they give something called an aggregate discount on the drugs. And it's a discount off of something called average wholesale price, which is AWP, which the joke is stands for ain't what's paid, because it really means nothing other than it's just a marker in the industry. And so the employer contracts with the PBM. PBM says, we're going to give you this discount, but it's on the whole basket of goods, right? So all these fills coming through. And the PBM, at the same time, is negotiated with pharmacies to say, what average wholesale price discount are you going to give us for all this volume we give you, right? So, but again, it's an aggregate. So when you're doing things in aggregate, what does that mean? If I'm giving you an average price and I've got 100,000 claims that are coming through, I'm going to be overpaying for some claims to subsidize the cost of others when you kind of average it out to that number. That same thing is happening in PBM contracts. So when you show up to your pharmacy, somebody has the best price for that drug at that pharmacy. You just don't know who it is. And so when you aggregate all these different contracts underneath, so what we do is we aggregate more than 10 of those different discount cards. And what we're doing is saying, hey, think almost reverse auction concept. Somebody's got a price in there. I'm shopping real time with our aggregated discount card solution to pull the best price from over 10 different options, and it automatically comes back. If I just have one option, right, that's the only price I get. And if that was one of those drugs that PBM didn't have a great price on, but they had great prices on others, we just want to keep taking advantage of those best prices at the individual pharmacy. And this aggregate discount model just means nobody's ever going to have the best price on every single drug at every single pharmacy. It can't work that way. So we want to make sure we have as many options checking in real time every single time we're at that pharmacy, and that's how we pull up the best prices. So we aren't always cheaper than what the pharmacy benefit manager is for the employer. Sometimes we are. But when you look at it in aggregate, we are reducing an employer's generic retail spend. So everybody goes to the pharmacy, picks up all those drugs by 50%, 50.
Yeah. I mean,
Just by the nature of doing this, and employees save less. Employees are getting a lot of drugs for free now that they had to pay before because there's so much savings to go around when you just use this concept, which is, well, let's check the best price every single time. So back to what you started with, what's an employer supposed to do? Who's monitoring this? Who's looking out for this? We are now the ones checking that price. If it does run through the PBM, it's the best price for that drug. And the PBM doesn't have the best price for that drug, then we run it through our aggregated discount card solution, and that's what employers get access to.
Interesting. So it seems like everybody sort of wins so long as one party wins a little bit less. Is that a fair statement?
That's it. I never thought about it that way. I think that's a good way to look at it. I mean, yeah, our solution here is when we tell employers, yeah, in our solution, everybody wins. So either you had a good PBM contract on that drug and it fills kind of coming through, you're protected. We found a better price. You save money. The employees save money. You don't have to change PBMs, which can be, a time-consuming and a risky process for employers. So it's like, I don't have to change PBMs. I get the kind of overall, I'll call it what the wrap pricing from them, but I get to, on every single drug, check to see if there's a better price. And if there's a better price, I access that. So it truly is what we've been built, is just to say everybody wins, in this scenario. And employees get the drugs that they need. Back to that, like, why are we doing this? At the end of this, there is a person who needs this prescription, and we want to make sure it's affordable for them and they can get it.
Yeah. I mean, not to simplify it this much, but the easiest way I can think about it is, I remember I used to go to Best Buy when you'd buy electronics, physically. And before they sort of give you the retail price, you're like, hey, can I just check it on Amazon and maybe we can price match, because it might be cheaper on Amazon. But at least I had that sort of virtual marketplace as a benchmark, versus buying it for $100. Like if I wanted to get an iPad, if it hypothetically costs $100, but on Amazon it's $70, Best Buy had no choice to be like, well, I'd rather price match because at least I have foot traffic and you're buying through our store versus.
Well, and in that market, you had prices out there that you could buy.
Exactly. It's visible. It's known.
I think the challenge of the pharmacy benefit manager is nobody knows the price. You don't know the price until you show up at the counter. And that's where we really come in to provide that transparency, provide that visibility, or even if the employee just shows up, that 50% savings number that I mentioned, that's the employee going to the same pharmacy they always go to, getting the same drug they always get, and just exactly the example you brought up, just checking to see if there's a lower price that comes out. And so it really is just a procurement play of checking to see lower prices and not just paying what one person has negotiated in the entire supply chain.
I want to spend the last part of this segment with you, Chris, on, and thank you, by the way, I was thinking to myself, this is kind of like PBM for dummies. I don't want to say it this way, but it's like the book, the sort of
learning PBM,
segment. Yeah. So thank you for that, simplification, but also just, I would say, very valuable overview. What kept coming to mind is, I'm trying to think of the founder right now that's listening to you speak. One question I can really tell that they would be wondering to ask is how difficult it is for you, having spent now, 4 months building RxSaveCard, how difficult has it been cracking into a very regulated, established market with larger, more dominant players? I can think of other verticals similar to this, like fintech as an example. It could seem intimidating, right? Like you're still an earlier stage startup. You've raised a small amount of funding, which we can get into in a second. But yeah, is it intimidating for you? How do you get past the challenges of being the smaller incumbent?
Yeah.
Just curious.
It is a long sales cycle generally, to your point. So I think when you go into the space, it takes a long time for employers to evaluate a decision. They often might only make a decision on a vendor every 2 or 3 years. And so you do have companies. It takes a long time to get that momentum, which to your point can be very daunting. And take a lot of capital, take a lot of money. And that's why you see venture capital being very involved. in this space too, with different innovative solutions and how you look at it. When we looked at this, we wanted to take a little bit of a different path, which is we're not trying to be a pharmacy benefit manager or a PBM. We're not trying to compete in that space. What we're trying to do is find a simple solution using technology and our knowledge of the market to just make it easier to sit next to it. And so I think for an employer, then it's a much less risky decision, to go with a company that's only been around for a few months, like you said, because I still have my PBM. And really what we're offering is just access to these prices and everything.
Supplement.
So yeah, so we're not approving drugs, we're not denying drugs, like we're doing none of those things. We're just offering a way to facilitate the payment and access of those from a data standpoint. So that is what has allowed us, I think, to really hit the ground running, and have lots of new customers coming on already for January, even though we missed we really didn't hit the sales cycle for what, pharmacy benefit managers do. But people are seeing the value and they're seeing, how this can fit in to their benefits. So it's incredibly exciting. And every time we talk to pharmacy benefit consultants who are in this space, who know it, usually you kind of go through the conversation and like, what are you doing now? What, kind of what's going on? And we explain it. And it's like, okay, I get it. I do think I clearly have an advantage of just being in this space for a long time and knowing
you're
a lot
subject
of
matter experts.
Yeah, and the people. So I've built some credibility and trust that we know the problem that we're solving. We have a unique way to do it. So I don't know if that answered your question directly or not, but we've got a little bit of a different path, but it can be a long, capital intensive, road to really develop a solution in this space.
Well, and certainly, a large market opportunity. I think from one of the press releases I read when you announced your funding round, it's a sort of a 600 billion market. Definitely could be more as well. And obviously giving color to, I forgot to give Sean, our fellow friend here, a shout out. Speaking of how cap intensive it can be, but a nice shout out to our mutual friend Sean Ellis from Distributed Ventures, and the DV team is phenomenal. And I know they want to be early backers and pioneers in this space, primarily anything to do with employer services and insurtech. And so having, raised, I think it was $1.7 million, if I'm not mistaken, something close to that. I'm sure that helps, especially at this stage, to get you running. And it sounds like you guys already have tremendous momentum.
Yeah, it was super helpful. And just, I think, the advice and guidance, so when you're finding a partner, and I think also because we started off thinking, well, we're just going to build this on our own. Maybe we don't need, any capital to do with the idea of we're not going to be a PBM. That's not kind of what we're interested in doing. So I think that helped a little bit. We always kind of had this lean mindset on what we're going to do. So now that just enables us to just accelerate that, a little bit of building the things we need to build, well in advance. So we are ready, for those new, customers that are coming on. And that's, we have our heads down, working on now every day to just make sure it's flawless come January with those new customers that join us.
Love that. Chris, I'm going to end it off with one last question on your side, which is quick lessons from, I want to say, it's not fair to deem you as a first-time founder because you've created your own consulting, boutique firms in the past, but to the extent that this is that your first startup, let's say on the sort of health tech side, what lessons have you learned so far in a 4-month journey?
I think positioning, kind of in the market and making sure that product market fit, whatever it was, that we really kind of understood the dynamics of the industry, and I think it's one of those things where just knowing all the different pieces and seeing where we think it's going to go. Like, for instance, I think the cash marketplace is going to continue to evolve. I think that manufacturers are going to start selling more directly to consumers in these direct websites. I think there's going to be more and more drugs now that are offered in transparent ways outside of it. And you also still have the largest companies in America who have shareholders to answer to, and how they're going to respond to that to make sure they keep their profit, where it needs to be. And your point about new drugs coming to market and everything else, it's when you look at health spend and what's going on, it's increasing, and it kind of did a little bump this year, much higher than it's been recently. And a lot of that is driven by prescription drugs. People are on more drugs now than they ever were before. People are living longer, more drugs to help with that maintenance, new drugs coming to market. Again, think the GLP-1s, a market that did
Yeah, the
not
weight loss.
exist 2 years ago. And now these will probably be the best selling drugs, in the country when they come out. So it's an area where there's always going to be pain and what we need. But I also think just checking with potential customers to understand what stops them from making a change. Why do you still want to do business with this entity? What would you need to do to help you? How do we make it easy and simple? So I think those were the biggest things. Like, you can have a great conceptual idea, but if you don't understand how your end customer, what spot does that help them or not? Is it more work or not? Is it more risk or not? Like, what are they really trying to accomplish and meeting them where they are? I think is one of the biggest things that we've learned and continued, frankly, to kind of iterate a little bit on what that model looks like and how it can be super helpful for them.
Love that. Love that. Chris, I want to thank you again. I know I've gotten to know you now over the past, I want to say month. It hasn't been that long. Very fond of what you're building. I think I've liked every single LinkedIn post that you've, that you're highlighting, not just around the company, but around the space that you're trying to crack. And I think you're doing excellent work. And I want to commend you on both you as a thought leader in the space, but as a founder, a Chicago-based founder, which always is a nice cherry on the top. So I want to thank you for being on the podcast, my friend.
Thank you very much. This was great. I enjoyed it.